Hi everyone. Vitamin B6, also known as pyridoxine, is an essential water-soluble vitamin with numerous functions and uses in the body and has a long history of use. Vitamin B6 has recently gained attention in the media, particularly in association with peripheral neuropathy. So what is vitamin B6? Vitamin B6 is an essential water-soluble vitamin. There are various forms or vitamins of vitamin B6, and these include pyridoxine, pyridoxal and pyridoxamine, all of which transform into its active form in the body, which is the coenzyme pyridoxal 5-phosphate, or PLP or P5P as abbreviations. Supplemental forms include pyridoxine hydrochloride and pyridoxal 5-phosphate. So what are the functions of vitamin B6? So vitamin B6 is a versatile vitamin involved in more than 100 different enzymatic reactions and has numerous functions in the body. It's a favourite of a lot of health professionals because it just has a wide range of applications. So some of these applications or functions include the metabolism of proteins, carbohydrates and fats, gluconeogenesis, which is the formation of glucose from a non-carbohydrate source, amino acid metabolism, energy metabolism in general. So we're also looking at glycolysis in the Krebs cycle, electron transport chain activation, immune function, formation of hemoglobin and red blood cells, synthesis and metabolism of neurotransmitters, nervous system health, cognitive function, various transsulfuration processes, so we're going into the big biochemistry there, metabolism of homocysteine, regulation of hormone function, fatty acid metabolism, among many, many others. How does a vitamin B6 deficiency occur? A deficiency of vitamin B6, like all other nutrients, may arise from altered or impaired intestinal absorption, altered or reduced cellular or intracellular transport, impaired metabolism, poor kidney function, alcohol intake, liver dysfunction, the liver's not working effectively, and some medications. So there could be contraindications or interactions that we need to be looking at. Additionally, a deficiency may arise when the physiological requirement of vitamin B6 or even other nutrients is higher than the intake of vitamin B6 from the diet, or just general intake is suboptimal. So what is the presentation of a vitamin B6 deficiency? So how does this present? So vitamin B6 presents as microcystic anemia, dermatitis, seborrheic dermatitis, scaling of the lips, so very dry lips, cracks in the corners of the mouth, glossitis, which is a swollen tongue, depression, confusion, weakened immune system, peripheral neuropathy, and a number of other related neurological symptoms. Now I'd like to sort of look into, the digestion, the absorption and metabolism of vitamin B6 because it's a deep, deep process. And as you know, I love biochemistry, so let's dive into the deep end a little bit with this one here because just I love biochemistry. So when we look at it, pyridoxine, pyridoxal and pyridoxamine are absorbed from our food and supplements by the mucosal cells of the small intestine via passive diffusion. So what's passive diffusion? Passive diffusion is a process where a molecule or compound is readily absorbable without cell saturation by simply dissolving in the phospholipid bilayer, diffusing across it and then dissolving into aqueous solution at the other end of the membrane. So I want you to start thinking of the outside and the inside of a bubble. You know when you blow a bubble or you see a bubble? The outside and the inside, and in between that is your cell membrane phospholipid bilayer. So it's that diffusion across from the outside in. That's the process that vitamin B6 utilises. Pyridoxine and pyridoxamine are phosphorylated by pyridoxal kinase, here's your biochemistry, to form pyridoxal phosphate and pyridoxamine phosphate. Then these compounds are converted, oxidised, by pyridoxine phosphate oxidase enzyme system or the pyridoxamine phosphate oxidase enzyme system into the coenzyme pyridoxal 5-phosphate. This process occurs mainly in the liver and to a lesser extent in the mucosal cells of the small intestine. Due to cell membranes being impermeable to pyridoxal 5-phosphate, which means the pyridoxal 5-phosphate doesn't always cross the cell membrane, the pyridoxal 5-phosphate is dephosphorylated. So there's a process via the phosphoryl hydrolase enzyme system so that the pyridoxal can be released into the bloodstream or is directly attached to albumin and liberated by the hepatocytes, so in the liver cells, into circulation as pyridoxal 5-phosphate albumin complex. Now, pyridoxal 5-phosphate is also taken up by the erythrocytes or red blood cells and is carried by hemoglobin to other tissues around the body via circulation. Let's start thinking about synergy, because not everything happens on its own. There's a big synergistic process here. And a good example is B vitamins. They have a very big synergistic effect with each other. So an example of synergy is, riboflavin deficiency alters the metabolism of nutrients, especially other B vitamins. Another good example that we know about is when you take a B complex, of course, they will work together in certain ways with the metabolism of each other. But one particular area is utilised for the metabolism of homocysteine, neurotransmitters and various different pathways. They work well together by activating different processes. A good example of this is the MTHFR polymorphism. So it's the enzyme pathway. B2 activates a B6 stimulates. All these, I won't go into it too deep, that's a different session. But all of these nutrients have some kind of functionality in enhancing the effect of the MTHFR enzyme pathway. It's very exciting, it is. Now let's get into the deeper stuff of what is peripheral neuropathy, because that's what everyone's been talking about at the moment. So what is peripheral neuropathy? It's an umbrella term for nerve diseases affecting a specific part of the nervous system, which is the periphery, so the peripheral nervous system, being outside that of the brain and spinal cord. Peripheral neuropathy can affect anyone, and that's one of the points I want you to take away today. It can affect anyone. So think of the nervous system as a communications network broadband system with signals. In peripheral neuropathy, the nerve signalling is disrupted in various different ways. So one of the ways is signals are sent when they shouldn't be. Signals that should be sent are not sent. And then there's changes in the signal strength and quality, you might as well say, just like bad reception on your TV or your phone, that affects the efferent or the actual effect of what the body's trying to do. There's this sort of miscommunication happening. And that's where the peripheral neuropathy gets confusing for the body. Just so you know, there are more than 100 types of peripheral neuropathy that have been identified. Over 100. So many conditions can cause peripheral neuropathy, which means a wide range of symptoms can also be present and possible. Peripheral neuropathy can also affect different body parts depending on how and why it actually happens and occurs. So some of the symptoms of peripheral neuropathy include tingling, burning, numbness or pain, usually in the hands and feet. There also may be cramps and muscle weakness or muscle spasms depending on which nerves are actually affected. High doses of vitamin B6 pyridoxine, such as 100 milligrams up to 500 milligrams, and in some research studies up to 1,000 milligrams per day, have been associated with peripheral neuropathy. However, the peripheral neuropathy reverts gradually over time after stopping taking the vitamin B6 until it regains regular or normal activity. So there's a period of when there's no B6, the symptom picture reverts back to regular activity. It should be noted though that vitamin B6 deficiency has also been linked to several neurological conditions that may be present as peripheral neuropathy. So as peripheral neuropathy may be caused by various different health conditions and various different reasons, such as type 2 diabetes, autoimmune diseases, inflammatory diseases, infections, or actually physical injury, it should always be investigated. Talk to your healthcare professional. So let's talk about vitamin C products, vitamin B6 products I should say, the manufacturing. So in Australia, listed medicines are regulated by the Therapeutic Goods Administration, the TGA. And products are manufactured by TGA licensed manufacturers under strict good manufacturing practice, GMP, as well as the PICS guide. I won't go into those details, it's very technical. Ingredients are tested and must pass vigorous quality assurance checks, and there's many of these before use. If an ingredient doesn't pass these quality assurance checks, the ingredient is rejected and not used. Additionally, listed medicines are placed on stability programs. Now these stability programs are where a product is tested for its active ingredients at various different time points throughout its shelf life, So quality assurance is of utmost importance. So that's to show what is in your product and in your product over the shelf life of it. So whether you take everything in the first 30 days or in the first 6 months, the quality assurance of the stability is there. So vitamin B6 in products, and this is where it gets a bit tricky. Due to the versatility and the applications of vitamin B6, various functions and just what everything does, it may be included in combination with other ingredients in various products. And some of these products include, multivitamin mineral formulas, B complexes, muscle and nervous system products, and many, many other products, just due to the versatility of vitamin B6 and what it does in the body. So please always read and check the label. Just double check your products that you have right now. The use of multiple products could lead to a stacking effect of vitamin B6, where each product you take actually keeps adding to your vitamin B6 stacking or load. So please always, as I said, check the labels, double check. If you're not sure, please consult an accredited qualified health practitioner. Now let's have a look at what has happened in the last few years. So since the 2020 model, there's been a lot more research come through. The daily dose amount of vitamin B6 has changed and warnings have been placed on labels. In particular in 2022, the TGA investigated possible links between vitamin B6 and peripheral neuropathy and made some determinations. One of these was that the maximum recommended daily dose of vitamin B6, equivalent to pyridoxine, in individual products was reduced from 200 milligrams per day to 100 milligrams per day for adults, and lower daily dose limits for children depending on their age group. Listed medicines containing vitamin B6 vitamins such as pyridoxine hydrochloride and pyridoxal 5-phosphate with a maximum recommended daily dose of more than 10 milligrams per day are to have a mandatory warning statement on the label. And this warning statement is read as this. Warning: stop taking the medication if you experience tingling, burning or numbness, and see your healthcare practitioner as soon as possible. Contains vitamin B6. So what I'd love to say right now is please always read the label, follow directions for use, and if symptoms persist, talk to a health professional. So to conclude, vitamin B6 is a versatile nutrient with numerous functions and uses. It's a wonderful, versatile nutrient. Peripheral neuropathy is an umbrella term for nerve conditions affecting the periphery. Peripheral neuropathy has numerous causes and it can happen to anyone. So please be aware of the products you take, and if you're unsure, consult an accredited practitioner, qualified health practitioner. But one thing I want you to remember is this: it's very important that you don't feel anxious about the issue of vitamin B6 and peripheral neuropathy because it's in the news a lot recently, it's in the media. And that for your health concerns, please consult an accredited qualified health practitioner for all your health needs. So, please always read the label, follow directions for use. If symptoms persist or worsen, talk to a health professional. Take care, and I wish you all the very best.